Molweni, good day, goeiedag, sanibona, dumelang, nda, abushini. Welcome to another video from Mzantsi Medics by Dr. Siko. It is Heritage Month here in Mzantsi, Africa, and I hope you are enjoying your Heritage Month. Today I'm going to be talking about a very important neurological assessment tool, which is the Glasgow Coma Scale. A downloadable PDF summary is available on the Mzantsi Medics website. This is a visual aid of the Glasgow Coma Scale. As you are aware, here at Mzantsi Medics, we love our visual imageries. The Glasgow Coma Scale was first introduced in 1974 by two neurosurgery professors, Tisdale and Janet, from Glasgow University. The Glasgow Coma Scale is a tool used to assess the level of consciousness. It is used for both trauma patients and patients with medical conditions. It helps determine head injury prognosis and mortality. The GCS is incorporated in most protocols of Mzantsi Africa hospitals. The GCS was revised in 2020, and some of the terminology has been changed in order to make the GCS clearer and less ambiguous. It is important to keep up with the latest version of the GCS in order to avoid confusion. Let us look at the scoring of the GCS. The GCS score is the sum total of all the examined 3 components. It ranges from 3 to 15. The lowest possible score is 3 and never 0. The highest possible score is 15. The higher the score, the better the neurological prognosis. The lower the score, the poorer the prognosis. Let us look at the components or the criteria which is assessed in the GCS. As seen on the picture, the GCS consists of 3 components. The first component is eye opening. The second component is verbal response. And the third component is best motor response. Eye opening out of 4. These are the possible points that a patient can score for eye opening. A score of 4 is allocated if a patient opens his eyes spontaneously. A score of 3 is given if a patient only opens eyes to sound. A score of 2 is allocated if the patient only opens their eyes to pressure which is applied on the nail bed for 10 seconds. Patient scores 1 if they are not opening their eyes. The suffix NT is allocated if the patient if the eye opening cannot be examined. For example, if there are bandages covering the eyes or there is severe periorbital swelling. Verbal response out of 5. These are the possible points that a patient can score for verbal response. A score of 5 is allocated if the patient is orientated with regards to place, person, and month. If the patient is confused, then a score of 4 is allocated. For example, a patient who's speaking only in phrases and incomplete sentences. If the patient only speaks with understandable or intelligible single words, then they score 3 points. If the patient is only making sounds, then he or she scores 2 points for verbal response. For example, a patient who's moaning and groaning. If there is no audible verbal response, then the patient scores 1 for verbal response. If verbal response is untestable, then the suffix "nt" is allocated, for example, in an intubated patient. Best motor response is out of 6, and it is assessed in the following manner. A patient who obeys your commands by either protruding his tongue or grasping your finger is allocated a score of 6. A patient who is localizing the pressure that is applied on the trapezius muscle or the supraorbital notch by raising his hand above the clavicle towards the stimulus is allocated a score of 5. A patient who responds to the pressure on the trapezius muscles with normal flexion is allocated a score of 4. Normal flexion is described as rapid elbow flexion away from the body. A patient who responds to pressure on the trapezius muscle with abnormal flexion is allocated a score of 3. Abnormal flexion is described as slow elbow flexion directed medially across the body. This type of response is referred to as decorticate posturing and is suggestive of neurological injury which is superior to the red nucleus in the midbrain. A patient who responds to the pressure on the trapezius muscle with elbow extension is allocated a score of 2. This type of response is called decerebrate posturing and is suggestive of injury inferior to the red nucleus in the midbrain. If there is no movement, then the patient is given a score of 1 for best motor response. If motor response is not testable, then the suffix "nt" is allocated. For example, in cases such as paralysis. If there is asymmetrical responses between left and right, use the side with the best motor response. Traumatic brain injury. This picture shows how traumatic brain injury is graded using the GCS score. A GCS of 13 to 15 is considered mild brain injury. A GCS of 9 to 12 is considered moderate brain injury, and a GCS of 3 to 8 is severe brain injury. After the Glasgow Coma Scale was revised in 2020, some of the terminology has changed. For best motor response, flexion replaces withdrawals. Abnormal flexion replaces flexion. For verbal response, words replaces inappropriate. Sounds replaces incomprehensible. For eye-opening, to sound replaces to speech. To pressure replaces to pain. What are the challenges and drawbacks with regards to the Glasgow Coma Scale? There might be a language and communication barrier. For example, the healthcare provider might be speaking in English while the patient's home language is isiXhosa and only understands that language. The patient might be suffering from hearing loss. The patient might suffer from speech impediments. There might be pre-existing neurological dysfunction which give false results. The patient might be intubated. The patient might be heavily sedated. There might be severe periorbital swelling. The GCS is difficult to assess in intoxicated patients and in patients under the influence of certain drugs. There are numerous applications for the GCS score. The GCS is a guide for some important decision making with regards to patient care. For example, definitive airway insertion, admission to specialized care, and the decision as to when to transfer. Other neurological scoring tools worth noting include the 4 score, which is full outline of unresponsiveness score, the Glasgow Coma Scale pupil score, the pediatric Glasgow Coma Scale, the simplified motor scale. Once again, thank you for watching this video. Please press the like button if you liked it, share with your colleagues, subscribe to my channel for free in order to receive notifications about future videos, and leave a comment down below if you would like any clarity.